Pertussis is a highly contagious bacterial respiratory tract infection, common in children and in adults. The incubation period is 7 to 21 days. The complications include subconjunctival hemorrhage, otitis media, apnea, pneumonia, bronchiectasis, activation of latent tuberculosis, dehydration, fever, convulsions, even rectal prolapse, and malnutrition. So admit to the hospital when complications are present, and this condition can be prevented by the 5-in-1 immunization, that's the pentavaccination, recommended for all children. So in the event of a child developing pertussis before immunization, the 5-in-1 vaccination should still be given to protect against the 4 other conditions. And during epidemics, or when there is a clear history of contact in a child with catarrh, appropriate antibiotics may help reduce a period of infectivity and transmission. Also, all cases should be reported to the district disease control officer appropriately. So the main cause of pertussis is Bordetella pertussis. Okay, so the symptoms, we have the catarrh phase, the paroxysmal phase, and also the recovery phase. So for the catarrh phase, that's initial 1 to 2 weeks. There is low grade fever, nasal discharge, and also mild cough. And for the paroxysmal phase, within the following 6 to 10 weeks, there are episodes of violent repetitive cough ending with inspiratory whoop or vomiting. The whoop may be absent in babies and adults. So for the recovery or the convalescent phase, as the next 2 to 3 weeks, there is gradual reduction in bouts of coughing. Okay, so the signs that are usually elicited are apnea, as a long pause in breathing is common in babies, and cyanosis too. Investigations are FBC, that's full blood count, high total lymphocyte counts usually detected, and also chest x-ray to exclude other causes of chronic cough. So the treatment objectives are to reduce transmission and also to prevent complications. Non-pharmacological treatment, feed frequently between coughing spasms, and also encourage adequate oral fluid intake. For pharmacological treatment, so patients and close contacts within 14 days of onset of symptoms. The first line treatment, you give erythromycin oral for adults 500 milligrams 6 hourly for 7 days, and for children 8 to 12 years, you give 250 to 500 milligrams 6 hourly for 7 days, and 2 to 8 years, you give 250 milligrams of suspension 6 hourly for 7 days, and for 6 months to 2 years, give 125 milligrams of suspension 6 hourly for 7 days, and less than 6 months is not recommended, but there's a risk of pyloric stenosis. And you can consider trimethoprim or sulfamethoxazole instead, or you can give azithromycin oral in adults 500 milligrams daily for 3 days, and in children 10 milligrams per kilogram body weight daily for 3 days. It's not recommended for children less than 6 months because of risk of pyloric stenosis. And for this, consider trimethoprim or sulfamethoxazole instead. Or you could also give clarithromycin oral in adults 500 milligrams 12 hourly for 7 days. In children, 7.5 milligrams per kilogram 12 hourly for 7 days. And the second line treatment, you give trimethoprim or sulfamethoxazole oral, as you give adults 160 800 milligrams 12 hourly for 7 days, and in children 4 by 20 milligrams per kilogram body weight 12 hourly for 7 days. So oxygen therapy, when oxygen saturation is less than 92%, you give oxygen intranasal or face mask. And if the patient has difficulty in breathing or is sinused, so referral criteria, we refer infants who have an episode of apnea or cyanosis after initial resuscitation to a specialist.